And lastly, please know this is a safe space and support session for care coordinators. I'll hand over now to Rachel. Hopefully she's now joined. Just bear with me. And I'll just see. Rosie, I think Rachel is on the line. Brilliant. Thanks, Nisha. Rachel, is it good for me to hand over to yourself now? Just bear with me for a moment. Thank you. I think Rachel's been held up, Nisha, for a little bit. But in the meantime, if I can just ask who's joined, have you actually heard of Anima? So this is the online consultation tool, the AI digital tool. Just interested to know how many people have heard of Anima or have actually used Anima. If you can just write it in the chat, that'll be really helpful. Thank you. So I can see in the chat quite a few of you haven't heard of it. So I'm hoping this is going to be a really interesting session for everyone. It's quite an advanced AI tool. So we've obviously all used Accurex, but that's more of a communication tool, and they've actually added on triage, etc. So this is actually a single integrated platform with Anima, and they've got the various work streams onto this one platform. So we're still, unfortunately, still waiting for Rachel to join us. So if you could just bear with us for just another couple of minutes, and hopefully I'll try and organise for that to happen. Thank you. Can I just also ask, would everybody be interested in a face-to-face forum if we were to organise it next year? Would that be something you guys would be interested in? If you could just write in the chat, or if you want to come on the mic, that's not a problem. Thanks. Okay, I can see that I think the vote goes to online. But yeah, I do appreciate that as well, Marina, that it would be a chance to meet other care coordinators. Perhaps, I don't know, we'll try one that is convenient, that we can negotiate a good time for with everybody. I think it would be nice. I kind of agree with Rowena that it would be nice to meet with other care coordinators also. Um, we'll definitely put it to the vote again sometime next year and see if it's still something that we can organise. Thank you. I apologise for the wait, but Rachel is due to join very soon. I think she's just been on another call, so just bear with me. Thank you.
Thanks, Fozia. I just want to add my 5 cents about the face-to-face forum. So if we do have one, what time of day would best suit? Would it be like in the afternoon, just for a couple of hours towards the end of the day, or what generally do your diaries look like? Because I appreciate completely that you can't have half a day out. So maybe like a 3 to 5, would that work for you guys?
Nisha, I think we've got Rachel
Yeah,
has now
we
joined
do.
us. Is that okay if we just hand straight over to Rachel? Rachel,
Yeah.
hiya. So we've just made the introduction. So
Perfect.
is it okay if we can just hand over to yourself? I'm going to stop sharing my screen, and then we can hand over to yourself if that's okay. Thank you.
Thanks so much, Fozia. Thanks,
Thank you.
rest of the team for joining. Really appreciate the time and thank you for giving an introduction. I'm sorry that I couldn't be here right from the beginning. I've been sandwiched in between a couple of calls. So yes, it's really nice to meet you all. By way of intro, I'm Rachel. I'm one of Anima's co-founders, but I actually spend most of my time with our sort of customer-facing team on the ground, which really means meeting with practices, teams, PCNs, federations, whoever it might be, that are interested in what Anima can do, and actually getting you started with the platform and how it might be able to impact on your practice. I think the agenda that I've got today is pretty far reaching. I'm going to try and squeeze as much as I can into the next kind of 40 or so minutes and then leave some time at the end for questions. Yeah, Fuzia, you put together an awesome but pretty ambitious agenda to try and get through. So I will definitely make sure that I try and cover at least those things. And then if there's a few other bits that I can squeeze in as bonuses on top, then I will try to. I would love for this to be kind of as interactive as possible. I don't want it to feel like I'm just talking at you for like the next 40 minutes. So if anyone does want to come on camera and if you, as I'm going along, want to shout out any questions, ask anything, please do that. I know that we've got probably a bit of a mix of at least practices and localities and maybe you're all from different teams, but I'd love to kind of hear from you guys if there's anything in particular thinking about your kind of patient access today or thinking about the role that you have today, anything that you would particularly want to see. Like if I could show you, if I could wave a magic wand or you could wave a magic wand and you could see something that would allow you to improve your day like 200 times, what kind of things would they be? Like, what's top of mind for the group here at the moment? What's really kind of challenging for you right now? If anyone either drop it in the chat, shout it out, someone either from your perspective or from the perspective of the forum as a whole, that would be a really great starting point because then it means I can try and show you some things in Anima that might be able to help.
Hi, Rachel, it's Fawzia. Yeah, I mean, for me, a lot of it's going to be about call recall. So
Mm.
that would be quite an interesting one to touch on. I mean, obviously, we're using various kind of AI tools at the moment in practice, but it's what are the unique selling points for Anima, essentially. So I kind of put together that agenda. So yeah, I would be interested to know in terms of call recall, how is it that you can kind of improve that work stream, with your workflows? I know you've got workflow that you're bringing on board. So how can you actually help with call recall particularly? Thank you.
Awesome. Yeah, that is definitely on your agenda. And yeah, it's one of the kind of newer parts of the product that we're working with practices right now, actually, to kind of build out and hear what would make that that easier. We know that often for things like QoF, for long-term condition recall. Yeah, like you say, at the moment it can be a super manual process. It takes someone a lot of time to do some of that. Anything else that people would find helpful to kind of see or think or talk about? Don't worry if not, we can sort of launch in and I can give you a little bit of an overview of what it is that Anima does and how we might be a little bit different to the things that you're working with right now. So I guess at the very kind of highest level, we kind of think of Anima as the next generation platform. So you're probably all very, very familiar with tools like AccuRx, eConsult, tools that allow you to kind of have that initial patient contact. So if someone is having an issue at their practice, they maybe will come in and submit something through those tools, and then somebody at the practice does something with it. So we take a pretty different approach to how those current tools are working, in that we want to be able to give you at the practice all of the information that you need to be able to actually make a decision about next steps. What we also do is we also know that, there's much more to kind of a primary care encounter or a patient's experience with primary care that goes beyond just that kind of initial send something to the practice and wait for them to come back to me. So that's why we also support other tasks that you and your teams will probably be spending a lot of time on, the kind of automated workflows that Fozia was talking about, but also document processing, automated coding, summarization, saving back to the record of documents. So again, if some of you are using something like DocMan or EMIS or System 1 to just manage incoming documentation relevant to patients at your practice, that is also something that we can support with. Transcription. So some of you might be familiar with kind of ambient scribe technology, which is the concept that if you're in a face-to-face consultation, for example, you could have a live transcription happening. So Annie, who you will meet in a second, our kind of AI co-pilot who is running a lot of what Anima does. Annie will essentially sit in with your consultation and take the notes for you, essentially. Write up the transcript of the consultation, turn that into a set of clinical notes, code everything, and then save it back to the record. So they're kind of the core focuses that we cover right now. And all of that is driven by really the recognition that there is a lot of probably just basically untapped productivity in what you guys are working with right now. A lot of this is manual processes that you kind of just, there is no, at the moment, good way to speed these things up. And you're kind of plagued by, when you are working, for example, on the patient online consultation side, the quality and amount of information that you might get from patients isn't enough to allow you to actually be able to close that encounter or resolve that consultation without getting into a long back and forth between you and the patient. What I'm going to do is I want to start sharing my screen and then try and just work through some of those use cases in a bit of detail and just show you what Anima looks like and the types of things that you might be able to do in it. As I'm sharing, I'm kind of old school. I've only got one screen. So if you have questions, if you type them in the chat, I might not see them. So if you do have any questions or you want me to stop and pause on anything or just kind of reflect on anything that I'm showing you, please actually just shout out and interrupt me. I won't be offended at all. And it would be actually really great to hear what you think about what you're seeing. So yeah, as I go along, please just shout if you want me to pause on anything. But can somebody confirm before I kick off, again, just by shouting out, if you can see my screen?
Yeah, Rachel, we can see your screen. And not to worry, I can have a look at the chat. It's not a problem. Thank you.
Perfect. Yes, please. Yeah, if there's anything that comes in, give me a shout.
Yeah, no worries. Thanks.
Cool. So this is what Anima looks like. This is the sort of central dashboard. And this is where the teams that are using Anima, and there's probably about 400 across the country now that are using Anima in some kind of form for at least one of those use cases I spoke about. So either online consultation, document processing, or transcription, or for some practices, all three of those. So the entire kind of end-to-end module they're using. And this is where you will spend most of your time. I'm going to spend the first kind of 10 minutes or so focusing just on the kind of online consultation or the triage side of the platform, because that is actually still where most of our usership is. It's still what most teams spend most of their time in Anima doing. So the idea being is that a patient will have come in, and I'll show you a very quick glimpse of the patient interface in just a second. But the idea being that this is where all of your incoming requests will sit. Now, for practices that are using, and this will differ from practice to practice, right? So if you're a practice that is using clinician-led triage or care coordinator-led triage or some other model, it will still look like this, but the kind of processes that you follow might look a little bit different. So the one thing that you can do straight off the bat is the level of automation that we give you as a team is really personalizable and customizable by you. We don't mandate that you automate things. We don't take that decision for you. But what we do allow you to do is to do some pretty interesting things. Now, the place that I'll start is coming in here and thinking about automatic appointments. So this, for most of our practices, will actually cover probably 20 to 40% of the incoming contacts that you get. And so this will look at things, and these are some really common examples that we see. For something like someone submitting a request for a smear test or for an injection appointment or for an MSK problem, there will usually be instances where if they answer the questionnaire that we show them in a particular way, you will probably know, or the practice, process that you've set up will say, if they present in this way, we're always going to want to see them. They're always going to need to be booked into an appointment because we need to do an examination, or we know that we need to then give them their next injection or something like that. So what you can actually do is just set up these rules to say, look, if a patient comes along and they're submitting something through Anima for an injection, if they answer in these particular ways, what we will do is actually say, thank you for your answers. We've checked them and you are eligible to actually just book straight into an appointment. And then what you can do is you can show them the types of appointments that are then suitable for that. So and again, this might speak to, I think the team were quite interested in understanding the differences, for example, between us and maybe something like AccuRx, where you have this kind of self-book functionality. Again, you're probably very used to sending patients self-book links and things like that. Where we are slightly different is that you can really drill down into the exact slot types that you want your patients to be able to book from. So for something like an injection appointment or for a smear test, you might actually only want to offer particular slots with a particular nurse at a particular practice site, for example, especially if you work across a PCN. And it's worth saying that everything I show you here works across one practice, but it would also scale all the way up to a PCN, a federation, or even a whole ICB. So in this example, I could say, well, if they are eligible to book straight into an appointment, I know that I want them to book in with this particular nurse at this particular site. And then actually, I also want them to only be able to book in on certain days. So I can pick some of my presets where I know I'm going to give them the next face-to-face appointment in the next 2 weeks, and they'll be shown the next 2-week block of particular appointments. So when a patient comes to the end of that questionnaire, they'll be shown this modal and they'll be able to book straight into that appointment. So that's one way that you kind of you maintain control over where patients are directed. So these automations are completely dictated by you and the practice. You decide what ends up being an automatic appointment. But once you have done that, that's usually a decent amount of demand that you're getting you get coming in from patients at the front door. So that's kind of the top level layer of automation. And so a decent number of these can be kind of shifted off that initial triage dashboard and just dealt with. The sort of second layer down, where maybe you don't want to necessarily set up an appointment for that patient, but you do know exactly where that request should go. So maybe it's something that actually will need somebody to have a closer look at what the patient has submitted in their history. What you can do is then just set up automatic assignments, which means that at a very basic level, you could do things like send all admin requests. So maybe that's letter requests, personal detail changes, all of that type of thing. Just send them straight to an admin team that you've configured in Anima. And then if it's a medical request, send that straight to a GP team, or it might be a wider clinician team, or maybe we send it straight to, I don't know, a particular R's team that you've put together first, and they will do the first cut of triage. You can then take that really, really granular and say, actually, for a particular topic or a particular presentation that a patient comes in with, for example, something like let's say whenever a patient submits an asthma request and it's for a chronic asthma flare-up, that just goes straight to the nursing team. It goes straight to your AMPs, and they're the first people that will look at it. And what that will mean is that if I come back to the dashboard, you'll see that all of these have a assigned user next to them, and it will tell you the ones that have been automatically assigned to that person or to that team. And then if I would to come in and filter my dashboard, say at 8 a.m. on a Monday morning, I can come in and see, well, what's been assigned to me personally, what's been specifically given to me, and then I can just work through this list. This is like your bird's eye view of everything that is happening across the entire practice, which you may not always need to see. You may only want to see what's been assigned to you or what's been assigned to your team. I'll pause there for any questions, and then what I'll do is I'll very quickly just show you what the patient interface looks like and then what it would look like to manage one of these consultations before we move on to another bit of the platform.
Rachel, can I just ask, is it, I mean, often more than not, a lot of the patients will kind of just talk about their issues, etc. But are you picking up on particular keywords, and is that how you're actually able to then slot them into these particular kind of appointments for, I don't know, say for asthma, etc.? Is that how you're picking them up? Is it based on the keywords?
Yeah, it's a really good question. And actually, then that's a great transition into showing you what the patient side looks like. So the patient perspective of Anima is quite different to maybe something, and I'll use the AccuRx example only because I was asked to kind of think about what the differences are between us and AccuRx in particular. But for anyone, if for all of the kind of, I guess, online consultation tools that you guys might have used before, you probably would have noticed like they all approach it slightly differently. So the AccuRx model is very much ask the patient sort of three quite open-ended questions. What's the problem? How can we help? What are you expecting? That kind of thing. That obviously leads to patients, the only thing they can do is they can just type in free text. So they can kind of raise a lot of different things. They can either give you one line, which is, I have a headache, okay? Or they can give you, 7 separate problems, everything that's ever happened to them. And it's reliant on somebody at the practice, whoever that is, to actually sit down and work out what is the problem here, what needs to happen next. The way that we approach that with patients is a little bit different, and I'll just show you what that looks like very briefly. So the screen you're looking at the moment is what the patient would see. Now, obviously, I'm on a laptop. This would be, this scales down to a mobile or a smartphone, and that's actually how most patients will access Anima. But this is what they will see. So everything that's on this first page is completely customizable by the practice. So you can set any kind of announcements. You could pop some quick links down here at the bottom if you know that you have very popular modules, like usually kind of like blood pressure readings, contraceptive pill checks, that type of thing. People will often put here so that the patients can get to them very quickly. All of these opening hours, that kind of thing is all set directly by the practice. But then when I come to submit a new request, what I can do, we've already split this out into medical and admin, and then a kind of outlink to just more general self-help on the NHS website. If I click medical and kind of ignore this is just one of our customizations where you can, a practice can say that a patient must configure an assigned or preferred doctor before they proceed, but we won't do that right now. The first thing we'll do is I'm going to say that I'm submitting it for me rather than one of my dependents. We will obviously screen the patient for any red flags. And then actually, if I select one of these and I'm directed away to more urgent care, if I switch my answer, we will say, be careful. You may not get the right care if you're doing this. We know that patients try and game this a little bit and say that something is very urgent when it might not be, but we will flag this to them and to the practice team that they've changed their answers so that they're aware. And then this is where we start to differ quite a lot from something like AccuRx, because we will ask the patient, what is the actual issue that you are, like, what is the problem that you're presenting with today? Because that means that we can take then the same history, or as information complete a history as we can, asking them the same questions that you or somebody at the practice team would have asked them, to then get the history that we need to make that confident next decision. So the patient can either scroll down this list, or I can type something at the top and I can spell it wrong, and we should still hopefully pick up the right module. So I can then click on this. If for whatever reason the patient can't find their problem, they obviously always can click that their problem isn't listed, and then we will take them through a much more kind of free text-based questionnaire. But for most cases, we will see that patients will select one of these structured questionnaires, and then you'll see that I'll use the asthma example that we were talking about. We will then ask them a real set of structured questions. That means we can then, that dashboard becomes what you've seen because we've asked these questions. So for something like asthma, we would take them through the asthma control test, and that means we can score it. That means you can see what their answers were, and then that means you can kind of pick those automations that you might want to set up. So you'll see that, you know, it's kind of meant to be quite easy still for the patient to follow. So it's mostly multiple choice. It's mostly just a one click and then move on to the next one. Where it's clinically relevant, we will then ask for more information. But if it's not, then we just won't ask the question, etc. I won't go through this whole questionnaire, but hopefully that gives you quite a nice sense of what the patient interface looks like, and to answer your question, how we then decide. So we're not using kind of AI to read any free text or anything like that, because we don't rely on patient free text to get us the information that we need. It's just, it's too risky to rely on patients to give us the most important information, because they might forget. If someone comes with a cough, they might forget to mention that, oh, and I was on a long haul flight last week. And that's something that we would be asking to make sure that we considered the risk of a pulmonary embolism or something like that. And a patient, just, you can't rely on them to volunteer that information themselves. Does that help? Does that answer the question and give you a little sense of the patient experience too?
No, that's great. Thank you. I think it's quite similar to Dr. Link. So prior to Accurx coming out with their triage tool, we used to use, well, in my practice, we used to use Dr. Link. So this was kind of a series of questions as you've got in Anima. And then obviously, you know, if the patient was required to, then they could actually book in, self-book into, you know, a slot. So yeah, it seems quite similar to that. But no, thank you for doing that. That's grand. Thank you. Anybody else got any questions?
I did put a question in the chat, but it never got read. So this sounds like it sits in it replaces Accurx, if I'm right. Yeah.
Yeah.
Just a quick question in terms of this. If a patient's got more than one health condition that they wanted to bring to the practice on the day, would they have to submit multiple requests?
That's the way it's set up, yes. So, and that's to avoid this issue where patients will submit one kind of question, but actually it covers 3 or 4 or 5 different problems, and you're still going to have to find, really all of those need a separate encounter, and they need a separate history taken from them really to understand what needs to happen next. Now we know that patients, you know, they don't always play ball, right? And so they will come in and they will say, I've got a cough, but actually there's something else that they want to raise. So at the end of all of these questionnaires, I've said that we try not to rely on free text as much as possible, but at the end of every single questionnaire, there will always be space for the patient to write their ideas, concerns, expectations. And then also, is there anything else that you want to raise? If you have another issue that you want to raise with your practice, please go and fill out the appropriate questionnaire so that you get the care that you need. If you're coming for practices, from our experience, if you're transitioning from something like Dr. Link or eConsult or another kind of tool which relies on structured questionnaires to do this, that's not really that surprising for patients, because they're used to the idea that I should submit something separate if it's a separate problem. Where you're coming from, practices that have relied on Accurx triage, which is just very kind of open-ended and unstructured. It's part of our onboarding and training process with the practice to engage with patients and say, you will get better care and you will get quicker care if you tell us about multiple problems in the right way. So if you kind of submit something separately for each one of those. But we know that people will try and get through the cracks. So that's why we always include that kind of open-ended free text box at the end.
Thank you. I did have one very, very quick question. I know that, you know, the series of questions are very similar to an eConsult, so it's probably already been considered. But for patients that have low literacy, learning disabilities, or language barriers, when you go through that list of conditions, they may not recognize their condition in that list because is there a simplified version or that would relate to them or to that group, to those potential groups, or is this translated as well into other languages? And
Yeah.
Yeah.
So there's a couple of things there. One of them is, yeah, you're right. This is definitely a struggle for all tools that are trying to do this. We were part of a study that NHS England did, looking across a kind of range of different tools and their accessibility. And for Anima, we came out, most of these tools come out around that the average reading age or the accessibility of this is kind of around reading age 7. So we expect that should cover a sizable proportion of most practices, but we absolutely know that it won't be everyone. And for some practices, depending on your demographics, that might actually still be very challenging. So there's a few things. Number one is that currently the patient interface is available in 10 different languages, and they just happen to be the 10 that have been most requested by our existing practices. But it covers ones that are probably not that surprising to the types of practices on the call today. So things like Polish, Ukrainian, Urdu, Hindi, and then kind of 6 others. We are getting kind of constant requests to add more every day. So we just kind of work on which one is most requested. The other thing to point out is that obviously this is not designed, this doesn't necessarily have to replace any more traditional, as it were, route into the practice. So what most practices will do is they will, even if they move to a total triage model, which actually most practices do, and this is total triage is where Anima becomes most powerful, even as part of that, there are ways for patients who, for whatever reason, cannot access this service. And it might be because, for example, they can't use this, whether it's a technical or a non-technical reason, they cannot use that patient interface themselves. What the options are is there is a kind of proxy route that the practice can do for them. So that patient can continue to contact the practice by phone or by just turning up at the practice. And what you can do is somebody on the team, again, this is usually the telephony team or the care coordination team, can take them through a similar sort of questionnaire, but instead you are just asking them the questions on the phone, maybe quite similar to how you are now, but we will give you all of the questions to ask. So if they were filling out an asthma questionnaire, for example, we would give you the asthma questions to ask, or we would just give you a very simple phone-friendly questionnaire, which is quite a lot shorter and probably quite similar to what you're doing today. Thirdly, the final thing is that you can create an account and add somebody as your dependent. So this is most common for kind of parents and children, but we often do also see it with, for example, children and their elderly parents, or a caregiver and somebody that they are caring for whatever reason. They can come along and almost set up like a caretaker account, and they can submit requests on behalf of that patient who, for whatever reason, again, can't do that themselves. So there's a few different routes that try and support. There's a kind of cohort of patients where maybe this access isn't this wouldn't be their kind of default mode of access, or they would find it particularly challenging, because we know that we don't want the introduction of these tools to disadvantage anyone. Where people can and want to use this tooling, they should, and that should hopefully then free up really other resources and other routes into the practice for the people that really do actually need to, for example, continue to ring the practice or continue to come in face to face. I hope that helped and answered the question.
Yeah, that's brilliant. Thank you very much.
Are there any questions that we've missed in the chat so far, or have we covered everything?
No, that's
Sorry,
everything. Thanks.
I
Oh,
had
sorry, go
one
ahead.
more, if you don't mind.
Of
Is
course.
this integrated with the NHS app?
So it is integrated with NHS login at the moment. So that means that if I were to come back here and log out, for example, as a patient, I can log in with my NHS login, and so I don't have to set up an email and password account. We are awaiting onboarding to the NHS app, and we've been given kind of Q1 next year as our slot to be integrated. So at the moment, we're not. If it was in our control, it would have been done like 6 months ago, but they have an enormous backlog, unfortunately, of people who are trying to integrate. So it's coming soon. Often people ask us that because they want to. This may not be why you're asking, but sometimes we get that question because practices are quite conscious of, for example, SMS costs, and they know that notifying patients via SMS even if it doesn't cost your practice money, it is costing your ICB a lot of money. So what we do is, number one, we can integrate into most ICB's kind of SMS gateways so that that doesn't cost anything to the practice. Number two, you often find that you send far less SMS through Anima than through something like Accurex because of that initial history gathering we've done at the beginning. You find that you don't need to ask as many follow-up questions. And then thirdly, we also enable you to kind of default contact to email addresses where a patient has an email. So if you're going to send them a message, you can default it to email. And then if for whatever reason that fails, then we will follow up with an SMS rather than going SMS first and kind of racking up those costs. But yeah, NHS app we expect to be at some point early next year if the team are able to stick to the timetable that they've given us.
Thank you very much. That's it.
I'm very quickly, before we move on to some of the other things that we covered, just going to show you what it would look like to kind of those requests that you had on your dashboard. Well, what does it look like when you go into one of those requests? Now, this is actually quite new. This is the new view that we're releasing to practices in a couple of weeks' time. So this isn't actually live yet. This is a preview of what's coming. But essentially this, and I'll walk through what we've got on the screen here, and I'll actually go from kind of right to left. So this is kind of what we call the patient context panel, and this is everything about that patient, and it's drawn directly from the EHR. So whether it's EMIS or System 1 that your practice uses, this will give you sort of a load of basic demographic information about the patient. So who are they? What are the most recent requests that they've submitted through Anima? If the practice is using our documents module as well, it will show you the most recent documents that have been received regarding this patient. And then it will list all of the kind of important stuff that you would want to know about the patient from their medical records. So what major kind of problem codes do they have on there? What medications are they on? Do they have any allergies and things like that? So this just kind of saves you that two screens, well, at least two screens, flicking back and forth between what you've got coming in from the patient today and what's actually in their record. You can see at a glance here, okay, this is related to one of their existing problems already, and I know that it's going to be saved under that. If you need to, for whatever reason, go and actually open EMIS or System 1 and see the whole record, you can, and you'll just click that button there. But for most cases, this will give you enough to kind of contextualize what's come through. This main panel in the middle is then what you will see. It's the report that we put together based on what the patient said in their questionnaire. So you can see that it acts a bit like a timeline. So this is a report that we've put together based on what the patient said in that questionnaire. So this is actually a low mood anxiety submission, but this would look reasonably similar no matter what presentation it is. It would just be different headings, for example, based on what's important. So instead of a kind of 3-page PDF or just like one long block of text, we've tried to make that as helpful as possible and structure it in quite a nice way. If you want to, you can always see the raw answers that the patient submitted, but usually, again, this is a nicer format to look at it in. So this is Annie, our AI, and this is the first sort of task that she can help us with. Annie will always give you a summary of what the patient has submitted. So again, you've kind of got the report, you've got the summary of everything that the patient has said. Annie will then condense this down into something that's really quite easy, hopefully, to immediately understand, immediately think maybe there's something that we need to do next, and will highlight in particular if the patient has kind of input any free text concerns, ideas or anything like that. Then there's various things that you as the team can do. So I can immediately send the patient a message directly about their request. So I can request more details and this will send them an email or an SMS in the same way that I just said. And again, I know that there's a similar type of, you might be using Accurex for this type of thing, but this keeps it all together in one place related to this exact request. So here's an example. One of the GP partners has sent a message to the patient asking for a bit more information. I can then also leave an internal comment for the rest of the team. So that might be like, hey, and then you can like at someone, you can mention someone else in the team, be like, hey, can someone take a look at this? I'm on leave now. Can someone make sure that we pick up this request at this time? Or hi, person, can you take a look at this request and sign it off? So you can see the kind of end-to-end journey that this request has gone through. And then when you're ready to actually put a plan together, so when whoever is signing this request off is ready to say what needs to happen next, you'll use this menu here to select from these types of things that you can do next. And there's a few different things that you can do. I'll actually come back to the live version to show you this. If I open, for example, this one, I can do things like, well, book them in for an appointment, and maybe I want to send them a self-book link, which is sort of similar to the ones that we saw before. So I can say, I want you to book within 2 weeks with, again, this particular member of staff. It will show you the number of slots that match that, and that will be sent to them. If you want to book the patient straight in right away, because you know, okay, maybe they need to be seen that day, and it's very obvious from the history that they need to be seen that day, you can actually just book them straight into an appointment, and we will read your appointment rota, your appointment book from EMIS or System 1, and you can just book them straight in. Then various other things, if you want to add a medication, change the medication, investigations, referrals. If you just want to send some patient education, a decent number of requests that we see come through our practices using Anima, the patient just needs some reassurance, some education, a link to some reading to help them manage maybe their, we can see that your inhaler adherence, for example, for asthma is poor. Here's some information on that can help you. We've given you a load of presets, but all of those sign-off options, you can then add your own as well, and they can be then reused across the organization. So that's kind of and then actually, I guess the final thing to say is that we are then, I think, as I mentioned earlier, fully integrated with both of the electronic health record systems, which means once you've done all of this and you've saved everything and put the plan together that you want, Anima will code everything, add all of the relevant codes, including, of course, cough codes. So anything like blood pressure, smoking status, BMI, if it's been picked up, if it's been asked in the questionnaire, which for something like asthma, we will always ask, what is your smoking status? If someone were to come in with diabetes, we would ask for their blood pressure, etc. So anything that's kind of cough relevant, we will automatically code for you, sort of show you this is what we're going to code. Does that look right? And so you can change it at any point if you want to, and then save it directly into the patient's record. So all of this history will be saved, your plan will be saved, and all of those clinical codes will be saved as well. And you'll just click up here. Because I haven't, it's saying close without action because I've not actually added any options, but I would click close and then that will save directly into the patient's record without you having to copy and paste, or there's nothing goes in as a random attachment or anything like that. It goes in line as if you'd written the notes yourself. I'm conscious of time. I've got probably like just over 10 minutes to like rattle through quite a lot of other functionalities. I'm very quickly just going to show you some of the other bits, and then hopefully I'll have some time for questions at the end if there was anything that we wanted to look at. So I know that one of the other questions was around sort of documents, and this is one of the other core bits of functionality that Anima covers. So if you think about the online consultation side of things as a replacement for something like AccurRx, this is a replacement for something like DocMan, or for just the native document processing in your EHR. So in EMIS and System 1, you are probably, maybe some of you might be familiar with how you process documents through those. With Anima, the difference, well, I'll walk you through some of the differences. So the way that documents get into Anima, we will set up with you. So there's a few different ways that they can get in. You can still do things like scan into your computers, put it into a folder, and then we'll just sort of read that folder. We then also do have an integration process that we work with practices on to move and transition whoever's sending them your documents, which is usually your local trust, to work with them to ensure that they send documents into Anima rather than into your EHR. So it all lands in Anima first. But once you're looking at a document, this is probably where the most exciting stuff is. So this is a real document. It's obviously redacted, but this just gives you a sense of the types of thing that you could do with this. So this is quite, it's a 2, 3, 4 page document. There's quite a lot going on in here. For somebody to actually sit down and read all this and understand what happens, it's going to take a good few minutes. And we know practices have kind of, you'll get 20-page documents, right? Or you'll have a 2,000 letter backlog, and it's relying on someone to sit there and go through all of them and code all of them, decide what needs to happen, etc. So there's a few things that Annie, again, can help with. What she will do is, now, because this is redacted, she can't find the patient, but in all cases, she will find the patient, she'll find some kind of identifier, which is usually the NHS number, and then automatically match it to that right patient in the record, so you know that it will save to the right place. She'll summarize that whole letter into, again, a one kind of paragraph overview of what's happening. which will make it easier for you to either decide who needs to action this or just to give you an idea of what's in these kind of 4 pages and what might happen next. We'll do a few bits of housekeeping, adding the letter type, the clinical department where it can be found, the event dates, and all of these you can kind of attune and fix yourself as a practice to point out which bits you definitely want to pick up. And if you want to always say that if it contains this letter, then always code it as this kind of letter type, you can do that. And then, information about the sender and the recipient will just pick out for you. That's easy. The data tab then gets quite interesting because what we will do is Annie will essentially find the right codes that this letter should be saved with, and she will prioritize things like QOF. So this little trophy tells me that it's a QOF code. And then she'll tell you why she's added this code by pulling out the bit of writing in the letter that tells her why that's been added. So again, all of that can be seen here. If you want to get rid of any of these codes, you can. If you want to add any more, you can. You can adjust Annie's sensitivity. So you can say, actually, Annie, you should be comprehensively coding, which means that you code everything that you find. Some practices really want that. Other practices will be like, we would only usually add 1 code for this letter. So Annie, do like the minimal coding, find the most like relevant 3 codes and just stop there. Don't add any more. Because if you coded everything in this letter, there'd probably be quite a lot. Some practices will want that, others won't. So you kind of got that done for you. These custom fields are something that, again, you can set up as practices and say, Annie, I always want you to find these type of things. So I always want you to find the clinical department. What's the follow-up time frame? These 2 are particularly interesting, I think, for most practices because it will always look for, well, what's the GP action? Is there a GP action in this letter? Is there a medication change in this letter? And you can set up as many of these as you want, and Annie will try her best to pick them up. For those 2 in particular, they're the types of things that you may then want to automatically turn into a task. So if there is a GP action, this is not a great example because the GP action isn't really an action. It's just telling the GP, like, don't do this. But often you'll find something where they're asking them to book in for a review in 2 weeks or consider changing medication regime to this. Annie's already found them. You can, again, check them, make sure you're happy, click add, and then we will, in system 1, either be able to add that. Usually we encourage practices to manage all of their tasks in Anima because, again, it keeps it all in one place. But you do also have the option to manage this in system 1. For EMIS practices, you will have to manage it in Anima because we can't access EMIS tasks. EMIS just don't allow you to save tasks. That's why DocMan exists as a product. But we've hopefully done a lot of the heavy lifting for you. We've found the actions, we found the tasks, and you can just add them straight in and assign them to the right people.
Rachel,
yes.
Sorry, Rachel, I've got a question from Rowena. So she's
she's
asked, would this also replace DocMan? I think you just touched on it then.
Yes, absolutely. That's exactly what this is designed to do. So this would completely replace DocMan as your document processing kind of product. So all of your documents would be processed through Anima instead, and hopefully give you a little bit more functionality than what you're getting from DocMan at the moment. The practices that we do have, I mean, we've got a good split. Some of them are coming from system 1, so that's sort of irrelevant. But then for EMIS practices, we've a decent number of them are transitioning across from DocMan. And actually, the whole reason we built this in the first place is because a practice that was using our online consultation module, who was also using DocMan, said, we don't like DocMan. It doesn't do what we want it to do. Could you please build something that we can use? And that's how we ended up here. So yeah, the idea is that it's a kind of complete replacement of DocMan.
So I think we've got a follow-up question. So it's when will this be rolled out to primary care?
When will this be rolled out? So everything I've shown you so far is live already. So we've got, I think I said at the beginning, about 400 practices that are using Anima in some guise, either one of the modules, like the online consultation or documents or our scribe. So this is kind of out there now. Obviously, this gets updated. We're about to release another release today, which is just some incremental updates, some improvements across all of our modules. But this is all live right now. If you wanted to turn around on tomorrow and be like, can we start using Anima documents? Then I wouldn't say we would turn it on tomorrow for you, but it's definitely something that we can get practices onboarded to right now. This isn't kind of in beta or anything. This is live at the moment.
Thanks, Rachel. Would we be able to touch on, I know we're quite short of time, but would we be able to touch on the workflows? Because I think that'll be really helpful because we're going through obviously end of year QOF, etc. and IAF. So would we be able to touch on that?
Yeah, what I'll do is I'll kind of just talk you through what that will, because that one isn't live at the moment. So that is something that we are building right now. But I can talk you through what we are working with some of those early beta practices on. And actually, there's probably a good example that I can use in the document, side. So just to give you an idea of what these flows will look like. So a good example of one of these workflows is the idea of auto filing. So we know that there are a good number of documents that practices will be working with where actually what happens at the end of it, it will just end up being filed to the record. It's for things like 111 letters, for example. All that will happen at the moment is that somebody will still look at that letter, but no action is usually taken. And so they usually just end up filing it straight to the record anyway. There's no kind of action for anyone to take. No one really adds any codes. Practices don't particularly code those. And so actually all they want to do is just automatically put that into the record. So that's one automation or one workflow that we're working with some early practices on right now, which is you can then upload a subset of your documents or get some documents into Anima. And what we will do is if you flag them for auto filing, that's exactly what will happen. They will just get filed straight to the record. No one will have to do anything. No one has to necessarily look at them. They will just get filed straight to the record with all of the kind of, it will go in as a 111 letter, etc. Thinking more around what you're kind of thinking for workflows, for QOF, for IAF and that type of thing. There's a couple of workflows that we're working on at the moment, and I'm opening up the messaging just to sort of show you that this is the type of basis that we might work this through on. So there's a couple of workflows that we're working with some of our bigger organizations, so some big practices, some big PCNs, federations, where this takes a lot of time. This recall process takes a lot of time to essentially say that because, again, if you're using Anima's digital front door, as it were, if you're using Anima as your online consultation tool, or you can very easily get all of your asthma patients, for example, to complete an asthma questionnaire. It will still rely a little bit on you pulling in some of those cohorts from the EHR. So sort of finding, well, what if patients are coded with X, or they have recently presented with this, or they have a consultation that has this problem code attached to it. Then what you'll be able to do is upload those patients into Anima and then just enroll them in some kind of workflow. And the first ones that we're looking at are things like, asthma reviews. For this cohort of patients, if they meet this criteria, send them this questionnaire, and then again, you basically build out whatever it is you want. You might wait for 3 days, check that they've actually then completed that questionnaire, and we can go and see. If I come back here, we can see, well, this is kind of part of this workflow work as well, that we'll be building out this table. We'll be able to see, well, it was delivered, and then if there was a request associated with it, or a questionnaire associated with it, was that questionnaire actually completed? And then you can take various actions off the back of them having completed that questionnaire. So for something like asthma, if they came back and said, actually, I've not had a asthma care plan put together in the last 12 months, or the ACT score is lower than 7 or 5, you can then prompt whatever it is that you might want to happen next. So if that's the case, then automatically send them a SMS or an email to book into a particular appointment, and then that's the kind of end of the workflow. So that's something that, apologies, I can't show you that right now because we're building it at the moment, but those are there are 2 or 3 pretty big organizations actually in London, funnily enough, that we're working with to sort of work through, well, what are the most useful workflows that practices would like to use, and what type of use cases would we use them for? And we know that QOF and long-term recall are definitely going to be the main ones that we'll start with.
Rachel?
Yes.
Sorry, just to so there's a question from Erin. She's asking, is Anima free, or would practices have to pay to use it?
Is Anima free? Someone unfortunately will have to use it. I wish that I could give this away for free, but I don't think my team would be very happy if I did that. So it will depend on a few things. what kind of module you're using. Usually it will depend on your ICB and whether they are funding Anima or not. Some of them will be, but others, particularly in London, they are about to kind of go out to re-procurement. So there are a number of organizations that are then self-funding. So it's either via their practice or through their PCN or through kind of PCARP funding, something like that, that they are funding Anima. So there is a charge to all of these, and they're all charged slightly differently. But that's definitely a kind of conversation that we would have with you and your practice, and just look at what kind of local options are available for you, because it will really differ depending on where you are.
Thanks, Rachel. Would we get to see a bit of Scribe? Is that possible?
I can show you like 1 or 2 minutes of Scribe, and then I definitely have to jump because I've got something right after this.
No problem. Thanks.
But I'll show you very quickly. So this is, again, for some context, yeah, you might have heard the phrase kind of ambient transcription. We know that for quite a lot of teams, it seems a popular thing for people to look at the moment. So what this is at the moment, this is primarily used in the context of a face-to-face consultation. So it will be if I were a GP and I've got someone in front of me and we're about to have a consultation, I can hit start. I won't do this now because I've got my headphones in and it probably won't really play ball with anyone else speaking. But I will click start and then I'll show you some real transcriptions. And Annie will start recording what is being said. Once the consultation is over, you kind of hit end consultation. Depending on the length of that conversation, Annie can take maybe kind of 10 seconds to a minute or so to process all of it. And then what she'll do is she will build the transcript for you. So she will give you the actual transcript of the two-way conversation that you had. And then what she'll also do is then she will put that together into a kind of set of clinical notes that's written and structured in the way that I think most teams are familiar with and would want to have. So again, it saves what we often find is, particularly with GP teams or whoever it is that's leading those face-to-face consultations, there's a pretty significant amount of time that's spent after that consultation or during that consultation, right? Trying to write down everything that's being said. And then afterwards, making sure that it is all accurate, tidying it up, putting the right things in the right place, doing the coding for you as well. Ignore this because I'm not connected. I'm not on, I don't have a live connection to EMIS at the moment, but if I had my EHR open, again, it would do something very similar to what you saw in documents, in that it would pull out all the relevant codes for this transcription and add them on. So we see practices come back with sort of time savings of, usually in the region of at least an hour per user per day by using this. It takes away that kind of split attention when you're in a consultation, to be able to just purely focus on the conversation. And then what Annie will do is actually listen and give you everything that you would need to pick up afterwards. You can see a few more examples. Let me see here. So, the full history. Okay, that one's not great if there's not been an examination or something like that. But yeah, the assessment, what's the presented complaint, history of presented complaints, what medical history was discussed, and then other various bits of the presentation that was discussed as part of that consultation. And then, probably most importantly, what's the plan that we're going to put in place and what happens next? And then the same thing, when I hit save to record, all of this will be saved into the patient's record with all the relevant coding added. You can edit, you can action any of this if you want to before it goes in, but that's the kind of overview. And then if you do want to send a follow-up message to the patient based on that consultation, and then more importantly, look at the auto-generated referral letter that Annie has put together for you based on that consultation, then you absolutely can too. So that's a sneak peek. That's probably nowhere near enough time to do Scribe justice, but that's an overview of the type of thing, what Annie can do for transcription, and then the types of things that teams are using that for.
No, that's amazing. Thanks so much, Rachel. Appreciate you doing that. Thank you.
Of course. I'm going to stop sharing and just say thank you so much for the time. If there are any more questions, please, I know that you're going to have some time after this, and I'm sorry that I can't stay, but if there are other questions, please just send them my way. Fuzia, if you want to share my email so that people have it. And if there's anything that you want to discuss directly, or if there's anything in there that you think, that's probably worth another chat or another little demo to dig into it in a bit more detail, please get in touch and we'd be really happy to do so. But yeah, I really appreciate the time. Thank you to those who asked any questions. And if there's anything else, yeah, please don't be shy to follow up.
Amazing. Thank you so much, Rachel. Really appreciate you coming on. I mean, Anima's platform, it's certainly got the potential to transform primary care, no doubt, and genuinely it will help us in our role. So thank you so very much. If we do get any questions or feedback, we'll certainly let you know. Thank you so much, Rachel.
Appreciate it. Thank you so much. Take care, everyone. Have a great day.
You too. Bye-bye.
See you later. Bye.
Bye. Oh, Nisha, I think you're on mute still.
Yeah, sorry. I'm just going to stop. I'm going to stop the recording so that the Mentee poll is